Okay, this is the Yvonne Chronicles vlog number 4. I've been keeping a diary, and when I last left you off in the last video, I told you about a doctor who did not want to follow the plan. I'm not going to go into a lot of detail, but so we are now on Friday, February the 24th, and the day before, I had a nice conversation on the 23rd with the palliative care doctor. We had an extubation plan. When people are extubated, meaning taken off the vent, my mom was on a ventilator. She never was supposed to end up on a ventilator because she had a DNR, DNI. The hospital doctors were chomping at the bit to get her off of the ventilator. I was fighting it because I saw signs of life, and that my mom, when I told her to squeeze my hand, she squeezed my hand. When she heard my nephew, she sat up in the bed, opened her eyes, and then she fell back. So we're on the 24th Friday, and the plan was my mom was going to get comfort meds, which include morphine. Morphine is a vasodilator. It helps you breathe. It also helps with pain. When we extubate people, we administer morphine for that reason, in addition to Ativan, which helps relax the person, okay? People are aware that they're being extubated, and they fight. Now, my mom, on the 24th, when I got there, Friday, she was fighting the respiratory therapist already. She was awake. Her eyes were open. I'll insert a picture either in the beginning or somewhere, maybe the end of the video. But my mom is awake, and she's got the tube in her mouth going down her throat. And they don't expect my mom to live. But I said, we're going to give her a chance. So this know-it-all nurse, now the doctor was off, but the know-it-all nurse, I'm not going to say the Karen type, but the Karen type, she was kind of like over-talking me. I was trying to explain to her the plan that the palliative care doc had in place, and that's what I wanted. That's what I agreed to. And she just was like, no, we're going to take your mom off the vent with no medication. That's cruel. Like, there's a standard of practice. So then she left. And then the ICU doctor came, and I said, the ICU doctor was like, oh, well, we're going to wait for palliative care. And I explained that palliative care was just here, and that she was going to defer it to the doctor, right? So they were playing tag with each other. So I paged the palliative care nurse, and I said, the doctor is here now. Can you come? So I'm being patient and respectful, right? I'm being patient and respectful because I know my mom ain't the only show in town, right? They're busy. It's the ICU. But when I saw that the doctor and the palliative care nurse were together, I approached them. The doctor dismissed me and told me, she said, I'm talking now. So I did not touch her, but I put my finger in her face and I said, don't dismiss me. And I said to the palliative care nurse, who said, we're talking about another patient right now. Can you excuse yourself? And I said to her, I put my hand up. I said, the only reason why I'm here is because both of you said you were looking for each other. And I saw that you two were talking to each other. And here I am, right? So I said, but I'm going to step aside. And I'm going to go in my mom's room. So when we went in my mom's room, and I was like, they were still trying to push we're not going to give your mother anything. They're just going to cold turkey pull the tube out of her throat. No pain medicine, nothing to help her breathe, and nothing for anxiety. I said, no, this is not what I agreed to. This is not what I agreed to, right? So the palliative care, so the doctor, so let me say this. They had a pharmacist that was there every single day, right? Every time the doctors rounded. And there was different doctors, right? But this pharmacist was already there. And I said to him, you know, I've been calm all week long. And he agreed. He nodded his head, yeah. Like he saw a different side of me. And And he saw that I was getting upset. And I said, I'm trying to remain calm, but I'm finding it difficult. So the doctor's trying to say, oh, yeah, there's more than one way to extubate somebody. You don't have to have meds. And I was like, you look and you see my mom is fighting the respiratory therapist. So my mom is tied, but you see she's anxious. So I said to the doctor, why won't you give her 0.25 of Ativan just to chill her out? You see she's got anxiety. This is when things switch, because when I start speaking the lingo, they know. They're like, uh-oh, okay, this ain't the regular bear. This bear knows tricks, right? So the know-it-all nurse says, would you like to step outside and not discuss this in front of your mother? I said, no. I said, I want to discuss it in front of my mother because my mother knows exactly what kind of daughter she has. And my mom is laying in the bed. It was so funny when I think about it. She's looking back at the nurse. She's looking back at me. She's looking at the doctor. She's looking at me because my mom knows I will go for your jugular if you mess with me and mine. And that's what they were doing. They were messing with me and mine, trying to pull the plug on my mom with no comfort meds, because you just see this old 92-year-old lady laying in the bed. And I'm not even going to bring the race card in it, but there's evidence-based articles all over the place, journal articles written by doctors and scholars that say that older black people and black people in general sometimes are under-medicated for pain and discomfort. We are under-medicated. So what I said to them is, after I said, no, my mom knows what kind of daughter she has, and no. And I said, you could give her the 0.25. And then the doctor was like, okay, this bear knows tricks. She told the pharmacist, go run and get me 0.25, right? We could have avoided all of this. Just do what why would you consult palliative care and then not follow the recommendations? So I said to my mom, I was like, Mom, I'm about to go. I got clinic. So then the know-it-all nurse, she heard the word clinic, and then she said, oh, well, what time do you have to be to clinic? I said, when I get there, because I got my own, and I ain't going to say the word that I said after that. So they extubated my mom, and that was on the 24th. I have my little diary. I told the nurse to watch her tone. She didn't follow through. She told me to get away because they were talking about another patient. And after they extubated my mom, guess what? They called me the same day and told me they were pushing me because they wanted to discharge my mom. And I was like, slow your roll. My mom, y'all just told me she was dying. And I was looking at funeral homes, not nursing homes. Okay? Slow your roll. And I was like, the case manager, I said to her, I said, nobody gets discharged from ICU. You have to step down. So meaning for anybody who's not medical, they can't discharge you from ICU. They have to slow your status, step down. And I am going to stop here because I'm going to tell you what happened, which is why they shouldn't be in a rush to discharge people, because my mom ended up with another complication. So if I wasn't up there playing hardball on her behalf, and that's what I said to the doctor and the nurse. I said, I am my mom's advocate. I am her power of attorney. I'm her health advocate, and I'm advocating for her. Give her something when you extubate her, before you extubate her. And after I put my finger in the doctor's face, she knew I wasn't playing. I don't recommend this, but don't dismiss me. Don't dismiss me. And this frequently happens when they just see me. I'm a very laid back girl. I'm sweatpants and tennis shoes and t-shirt. Like, I like comfort. So they assume many things about me because they don't know. But when I started speaking the jargon, the whole behavior changed. It shouldn't be like that. And I think about that all the time, how, one, what happens when I'm not present with my mom in these health situations, and two, what about the people who don't have somebody who knows the know? You know what I mean? Advocating on their behalf. But anyway, this has been Catching Up with Crystal. This has been the Yvonne Project. I'm catching you guys up. I told you what happened on the 24th, and then I will tell you what happened on the 25th and the 26th in the next video. I'm keeping my journal. Stay tuned, guys. Please like and subscribe. It's really going to help me. Hit that bell notification when you know when new content is posted, and I'll see you in the next one.